Thank you very much. The pleasure was all mine in Montreal. So my disclosures are that I am an employee of Cure Parkinson's, I'm the Director of Research, and we're a medical research charity that funds research in the Parkinson's space, where we are a funder of, inserted our logo in the following presentation. Excuse me. And I'd like to start firstly by thanking the organisers for the invitation to present today, and I'd also like to thank this wonderful group of people. You've got the amazing Brian Fisk in the bottom there, the saintly Kevin McFarthing, the incredible Sue Buff, who's been driving a lot of what I'm about to present, Gary the Hitman Rafaloff, and then Ken. Some people say he resembles Harrison Ford. I can't see it myself. Every year we get together and we put out a overview, a snapshot basically, of where things are in the world of Parkinson's research. And so I've used this as kind of the template for my presentation today. This is the 2024 update. The 2025 update is coming. It's currently in press. We were hoping it would be out, but it'll be out in the next couple of weeks in the Journal of Parkinson's Disease. And there's a good reason why it's been so delayed. This is the first time you guys are getting a sneak peek that this has been presented. This is what the pie chart looked like for 2025. And as you can see, the disease-modifying therapies, which go across the top there, are actually dominating the pie chart. This is the second year that this has happened, while symptomatic therapies go across the bottom. The coloration is different types of targets and mechanisms of action. And the main takeaway from this particular image is for the disease-modifying therapies, there's only 4 phase 3 clinical trials, so that needs a lot of work. The reason it's delayed, last year's report, is because it was the 5th year we were doing the article, and we thought, let's do something special. And I don't know who volunteered this, but we thought, let's go back and do an actual longitudinal analysis. Let's do a big data set and see what sort of trends we can see going across that data set. So we downloaded everything from clinicaltrials.gov and for the last 10 years, so going all the way back to 2015. And across the top, you can see the gray line is the number of clinical trials that are registered each year. We're not sure what happened in 2017, but you can see the impact that COVID actually had following 2020. The field is still sort of struggling to come back to where we were. And the other interesting trend in this graph is that while symptomatic therapies are trending downwards, that's the blue line, the orange line, the disease-modifying therapies, and they're trending upwards. So there's more disease-modifying therapies for Parkinson's being registered each year than symptomatic therapies. And the team breaks down each of these trials into different categories, as I said, based on mechanism of action or the target that's being addressed. And for the DMTs, for the disease-modifying therapies, across the different phases of clinical testing, you can see that there's a wide variety of categories or approaches being taken. But the main takeaway from this particular table is that over the last 10 years, there were only 9 phase 3 clinical trials for disease modification and Parkinson's registered on clinicaltrials.gov. And that's not supposed to be a demoralizing statement. Already this year, with the startup of the EJS ACPD multi-arm, multi-stage clinical trial platform, there are 3 phase 3 arms being added to this stat going forward. So if you are interested in this report, you can go to the WPC meeting over the next couple of days, and there'll be a poster presented, and the team will be there to walk you through it. But I thought it would be useful in giving you a current snapshot of what the GBA1 field looks like in templating this to what's the data that's available. And I need you to give me a bit of rope here, because I did this last Friday night after a few drinks. And there might be some errors. I'll point out the errors that I can already see. But this is what the snapshot of GBA targeting clinical trials currently looks like in May 2026. There are 20 trials, and half of them are in the phase 1, some kind of phase 1 phase of testing, and half of them are gene therapy approaches. Not all of the gene therapy approaches are phase 1. There is actually a phase 3 gene trial in there as well. And when you break them down into different categories, you can see that, oh, hang on, no, have I missed a slide? Can I go back? Yes, okay, so you break them down into different categories. You can see that there are specific groupings of clinical trials, such as GCase targeting, enzyme replacement therapy, glucoceramide inhibition, and alpha-synuclein targeting, as well as that gene therapy chunk. I thought it'd be interesting to go back and compare. I gave this presentation 2 years ago in Montreal, and if we go back then, there were 29 trials, so there's only 20 trials now. GCase targeting was a much larger portion of the trials that have been conducted, and now obviously gene therapy's really expanded. But this got me thinking, given the Parkinson's overview I just provided you with, it could be interesting to go back and actually look at what's happened longitudinally with regards to GBA1 targeting trials. And so after a few more drinks last Friday night, I downloaded all of the data you can from clinicaltrials.gov for clinical trials with the keyword Gaucher's or GBA1, and you get 91, after you clean it up a bit, you get 91 trials registered on the database. And the blue lines across the bottom are the trials being registered each year, and then the orange bars are the cumulative number of trials that have occurred over time. And it's nice to see a continuous trend upwards as opposed to any sort of plateauing. And if you take that full data set, you get a nice spread of phase 1, phase 2, phase 3 clinical testing on the left-hand side there. But if you break it down into the first 10 years and the last 10 years, you actually see some interesting trends starting to appear. For example, in the first 10 years, almost 40% of the trials were in phase 3. So this was a lot of ERTs being brought to market, and that's now shrunk down to just 16%. And you've got this large growth of phase 1, some sort of phase 1 level of clinical testing in the more recent 10 years. And if you look at the categories, you also see interesting changes over time. So you have this nice spread again of different modalities being addressed in the overall data set. ERT makes up about 30%. And in the first 10 years, that was closer to 45, but more recently it's drifting down towards 10%. Now I want to shift back to the current data set, the current snapshot 2026, and address each of these areas and look at the clinical trials that are being conducted. ERTs, there are 3 approved for treatment at the moment, and they all have the same sort of characteristics. They've got very short half-lives, and they've got very poor brain penetrance. The brain penetrance element of it is being addressed. For example, you've got the Insight Tech clinical trial where they're using high-frequency ultrasound to open up the blood-brain barrier and target GCase to the CNS. That will hopefully read out late 2027, early 2028. And you've got a lot of preclinical research going on with regards to the blood-brain barrier transport vehicles or shuttle technologies. Roche and Denali have got large programs in this space. And you've got a lot of other companies attempting to generate some sort of technology in the space as well. The ones across the middle where pharmaceutical companies have either bought or partnered up with small biotech companies. Then you've got the GCase targeting agents. This is replacement of GCase or glucocerebrosidase in well, the CNS or in the body in general. And of the 15 GCase targeting clinical trials that were conducted over the last 25 years, 10 of them were around this agent, this respiratory agent, ambroxol. And the most important of, or not the most important necessarily, but the one that's quite timely at the moment is the ASPRO-PD study, or ambroxol, to slow progression of Parkinson's disease. This is by Tony Shapiro out of UCL. And this is a 2-year phase 3 clinical trial involving 330 participants. Half of them have a GBA variant and half of them are idiopathic Parkinson's. And that will be reading out in about 2030, with UPDO's Part 3 being the primary endpoint. But at this meeting, we will be getting an update from Ari here with regards to the AGP1 clinical trial of high-dose ambroxol in GBA1-associated Parkinson's, so we can look out for that over the next, or tomorrow, I think is today or tomorrow you're presenting?
Tomorrow.
Tomorrow, thank you. But with regards to 2026, I don't want to put any pressure on the next speaker, but this year, the main clinical trial result we're looking out for is Bial's phase 2 Activate trial, which is testing their GCase activator, Variceptiract. It's a multi-stage clinical trial that's been testing 2 different doses of their agent in 237 participants, all with confirmed GBA PD. And so it'll be interesting to see what the next speaker is going to share with us. There's also the Gain Therapeutics and Vanqua clinical trial programs. These have both finished phase 1B now and moving on to phase 2, and we'll get presentations for those at this meeting as well. And then we've got a large group of stakeholders and biotech companies developing other GCase approaches for in this space as well. Then you've got the glucosylceramide synthase inhibitors, jet lag. There's 2 currently approved, but there are a number that are being clinically developed. Firstly, you've got Sanofi with their Venglustat program. There are 2 clinical trials ongoing at the moment. And you've got Yuhan Corporation out of China. They have a GSI also in clinical testing at present. And then you get to the gorilla in the room, which is the gene therapy approaches. They make up half of the category for the current snapshot, and there are 4 agents being clinically tested. 2 of them have 3 trials ongoing. You've got the Lilly program through their subsidiary of Prevail Therapeutics, and they've got 3 trials that are reading out in 28, 30, and 31. And then you've got Lingimed out of China. They have 3 trials which read out late 26, mid 27, and mid 27. And in addition, you also have Spare Therapeutics, which have a liver-directed AAV vector, and they will be reading out in 28 and 29. And Vitalogene will be reading out in 29 and late 27. That is a centrally delivered GCase encoding AAV9 vector. And a lot of preclinical work is being done in this space. People carefully designing capsids for peripheral delivery, targeting, in some cases, central cell types, and some very exciting work being conducted there. One particular collaboration I want to point your attention to is between Lilly and Prevail and Scribe Therapeutics, which is developing a CRISPR approach for GBA1. And then finally, the 5th category is alpha-synuclein targeting. So this is an investigator-initiated trial out of Tübingen in Germany, and it's testing Roche's prasinezumab, their antibody against alpha-synuclein, which is being tested, it's focusing on cognitive decline in 120 participants with GBA1 Parkinson's, and that should read out hopefully in 2030. So to summarize the main points, there is a low number of clinical trials ongoing at the moment for GBA1 approaches, just over the last 2 years, going from 29 to 20. They're focused on primarily 5 areas. And I should add that all of the data I've showed you is just what I've taken from clinicaltrials.gov. There's a lot of other registries around the world where phase 1 agents can be being tested, and that's just not being picked up here. This was, as I said, after a few drinks. New allosteric activators providing some encouraging results thus far. and CNS penetrant ERTs being developed at the same time, and a lot of developments going on with gene therapies. My only sort of real parting comment, if we're providing food for thought statements, is as I was going through this effort, I was thinking, wouldn't it be interesting to actually have some kind of basket trial or MAMS platform, multi-arm, multi-stage platform for GBA targeting approaches, as opposed to having individual trials ongoing by themselves. And with that, I'll say thank you very much.